Las heridas traumáticas son lesiones que están causadas por golpes, cortes o caídas. Estas necesitan una atención especializada para prevenir infecciones y favorecer la buena cicatrización. Bienvenidos a INNOVATALKS.
Welcome to a new episode of INNOVATALKS. My name is Daniela Santos and I'm part of the InnovaCure team. Today we have the honor of speaking with Brad Wiggins. He's an expert in wound management, in burns management. So welcome, Brad. What can you tell us about your experience in burn and wound management?
Yeah, thank you very much for having me today. So I have an extensive career over the last 35 years of managing burn patients in adult and pediatric populations at an academic medical center in the United States.
Thank you, Brad. So today we're here gathered to talk about a really important topic that is traumatic wounds. What can you tell us about these traumatic wounds and what would you tell us about the management of these wounds?
Yeah, so I appreciate the opportunity to speak about it. Obviously, the burn community and the trauma community manages all sorts of different types of wounds, and the types of ways of getting those injuries is endless. And just when you think you've heard a new way, someone comes up with a new way of getting injured. But I think in all communities, traumatic injuries are a big issue. They present a lot of challenges for the healthcare community, and they ultimately present a lot of challenges for the patient to actually get that wound closed.
Sure. Yeah, actually here in Colombia, we would have around 20,000 deaths from accidents each year. So the amount of patients that experience or have any traumatic wounds is really large. What would you say is the biggest challenge in treating this type of wounds, these traumatic wounds?
Yeah, I think the biggest challenge is wound closure, right? The ability to actually have someone's massive traumatic wound closed effectively so that they are able to return to a normal way of life. And I think that's the goal of all trauma care, is to stop the trauma process, to make sure that someone is stabilized, and then to focus on how do you actually use your surgical tools and your products and the different things that you have in your arsenal to care for that wound. So really there's so many opportunities and so many different directions to go with that, but it really is the biggest challenge, is how do you get a wound closed after it's there?
I think because of the nature of these type of wounds, infections are like a current topic that keep happening, right? I mean, I tried to think about a motorcycle accident and all of the dirt that is around the person that just got a really big wound. So do you know, or do you happen to use any innovative technologies in order to treat or to prevent the infection from these traumatic wounds?
Yeah, absolutely. So I want to back up on one thing you said there. First of all, is that these wounds, because they happen out in the community, they're traumatic wounds. Someone might wreck their motorcycle, as you said. Someone might have a burn accident out in a field somewhere and have to roll around in dirt to get it to be extinguished. Someone might have to jump in a lake that might have dirty water to be able to extinguish themselves. You just don't know how that wound has been impacted by its environment where it happened. So when these patients come in, they are very dirty, and those lead to infections very quickly. Infections can lead to massive complications, even death or sepsis for a patient, but they can also lead to extreme complications of someone maybe having to have an amputation of their arm or their leg based off of where those trauma injuries happen. And infection's the number one predictor of those types of things not going well for a patient. Patients can have a lot of comorbidities as well that impact those things. But in trauma care, most of the time, most traumatic accidents are people that it's not expected. They weren't planning for it to happen. Maybe they're a young, healthy person that was out doing what they love, like riding a motorcycle.
Yeah.
So I think the second part to your question is what becomes the most challenging component, and how do we do that? And are there interventions and things that you can do to help someone with those types of wounds? I think that yes, there's a lot of different tools and techniques to be able to think about how do you manage. One of the really amazing technologies that's coming out right now that has been around here in Colombia for some time, but also really starting to take note and usage in the United States, is that of a material that is completely bioabsorbable, that mimics that of the body's tissue and helps to be able to create and embed itself down into the tissues. It's a fully antimicrobial, silver-based product that is geared towards creating a wound matrix over that wound, promoting the opportunity to kill the bacteria and really allow for positive proliferation of the fibroblasts. So you have a product that can get down into the tissue, that makes contact where the infection is, which is amazing. But there's very few products out there that are like this that allow you to actually see healthy skin cell growth at the same time. Most of the products that have silver in them kill all the cells, including the healthy cells. So with having something that this product only has a 1 part per million of silver in it, and it allows for it to contour to the lining of the wound, it helps to have a matrix that creates and matches that of the human body, and it's made up of a polyvinyl alcohol that actually completely dissolves over a period of time. So it just doesn't have to be removed, it just has to be replaced because it's been absorbed by the body. Those are the kind of technologies that I think are really paving the way to help with wound closure, because they're killing the bacteria, they're stopping that process, they're allowing for healthy skin cell growth, and ultimately allowing for, within the reconstructive ladder, to be a mechanism for a physician to get better wound closure.
So of all of these characteristics that you just mentioned that these new technologies have, what would you say is like the most important characteristic in order to heal successfully a traumatic wound?
Yeah, I think the most common thing that develops in any type of traumatic wound is that of what's called biofilm, or infection that's over the entire tissue of the wound. And I think that's the most common challenge, and that having something to make a difference in stopping that process and promoting healthy skin cell growth is what really ultimately leads to having good wound closure.
Here in Colombia, we have a bit of a problem with access to this kind of timing, or proper timing, in order to save, the limb, or not to get into an amputation process when someone has a traumatic wound or a traumatic episode. What would you say is the benefit of using this type of technologies in terms of timing, in terms of maybe getting to these therapies faster?
Yeah, so one of the things I really love about this technology is that it can live on a shelf. So it can be in a box, inside a shelf, in a clinic environment that's very close to maybe where the person got injured. When you think about different levels of care and delivery of care, maybe they can't get to that expert that needs to be able to treat the wound initially. This is something that can be applied very easily by anybody really in the medical world. They simply open the package, they're allowed to size it, they can cut it, they can fit it, and it interacts with the body's fluid to immediately incorporate itself down into the tissues. And then the best part about it is maybe they don't have a follow-up clinic visit or see that physician that's the expert for a week. It's going to give them the ability to fight that infection right from the get-go of the injury. So those are the things that I really like about it, is that the goal of keeping a wound cleaned and promoting healthy skin cell growth is what leads to a faster, more appropriate wound closure for a patient. So when you think about the patient, again, that might not have access to healthcare, having it in a clinic setting that's in a more rural setting, they can immediately get that on, and then they can follow up with that expert provider at a different time.
Okay, that's amazing. And are these technologies usable before surgery, during surgery, after surgery? How can we use these technologies in a clinical practice?
Yeah, I love that. So in the United States, we have seen these technologies take place in both the trauma world, the burn world, the orthopedic surgery trauma world, dermatology, surgical spine, neurology cases, any type of back injuries where someone would have an incision. So the opportunity to be able to see how it could be used in all sorts of different care models really is the amazing piece of this technology. We have not had something like this that's really out there in the market that could really be incorporated across so many different types of care delivery. So I think that having that as an option is really become a really lovely opportunity for better wound closure.
In the US currently, are you using these technologies as a first option, or maybe you have another protocol in order to manage traumatic wounds?
Yeah, so I think this really neat thing about this technology is you can use it in all those different areas I talked about, and you can also use it over the kind of throughout the whole holistic time period of the patient's wound. So you referenced a question a second ago of, yeah, you can use it before the injury. Like the injury happens, you can use it. You can use it as what I call a prep to graft. So you're getting the wound bed ready for a skin graft if that's going to be what's needed for closure. Or you might just be able to clean it out well, to stop the infection process and close over it if you needed to be able to do it in that situation. But then if you have any type of area that still needs to have infection management after, you can continue to treat the area with that, which is really amazing technology. Yeah. It doesn't harm the healthy cells because it has such low dose silver. It helps very much to be able to promote healthy skin cell growth, which is, I think, the really amazing thing about this technology.
Yeah, it's really amazing. So what would you think are the benefits of using this type of technologies in terms of the psychological benefits that we could have in the patients that have a wound that is complex and hard to heal?
Yeah, I love this question very much because I feel like paying attention to understanding how these trauma wounds impact a patient psychologically is sometimes forgotten. Everyone focuses on the wound they might have, but ultimately, how does it impact the patient? So having a massive wound is going to keep someone from being as active as they want. It might change the way that they are able to participate in their activities of daily living, and it may be something where they're able to, not live exactly the same way that they did previously. So I think a technology like this really ultimately helps to close the wound faster, gives you the ability to have a decrease in length of stay, get someone home, right? They want to be home. They don't want to stay in the hospital. And ultimately, you're fighting infection and you're providing good, healthy skin cell growth. That all those things together are going to help the patient to have a better outcome and have less time in the hospital. I think that's just a huge benefit.
You're talking about a real important topic that is less time in the hospital. What would you say about the cost effectiveness of these kind of technologies?
Yeah, I think all hospital systems, no matter what country you're in, are concerned about costs. I think it's one of the challenges of healthcare these days is just how much does care cost? If you have something that's fighting infection, that's going to keep you from having to treat the patient for infection differently with the cost, right? Those types of things need to be viewed and paid attention to when it comes to patient assessment alone. So I think having a tool in your tool bag that can treat the patient cost effectively is a huge benefit. And this is something that I've seen very effective in the United States. It is a cost effective treatment.
So Brad, if you could change just one thing on the way we approach traumatic wounds, what would you change? What would you choose?
Yeah, I would say that the most common complication is not ensuring that the wound bed is prepped and ready for closure. I think so many times people assume that the wound bed is ready, but it's not. It's infected, or it doesn't have healthy skin cell growth, or it doesn't have good blood flow and circulation to the area. So I think that the most important key to any type of wound closure with any type of healthcare system is ensuring that the wound bed is prepped and ready to be closed. That could take weeks sometimes. Sometimes you have to treat a wound for a while before. Everybody doesn't want the wound in place, but assessing the wound bed and understanding if it's ready for wound closure is key. And I think that that's one of the things that I've seen with this technology is that we're able to apply it, kill the bacteria, promote healthy skin cell growth, and ultimately get the wound bed ready for wound closure, whether that's primary closure or whether that's with a skin graft or any type of skin flap.
So thank you, Brad, for joining us in this episode. We hope you enjoyed this new episode of INNOVATALKS, and we hope to see you in a different episode.